Mark always.
Oh, yeah.
Yep. Green room time.
Live?
Well, I don't know. I always like act like we, you always have to act like you are alive because you never know.
You never know.
Oh yeah, for sure. And the foofs
Yeah.
are there forever. We all know that. We're in the green room.
Right,
Awesome.
Good morning, everybody. Welcome to another episode of the Green Room as we're counting down to our 100th episode.
Yeah,
which is
I know.
Unbelievable.
It is pretty crazy.
I mean, that's crazy. We're going to have to plan some great, phenomenal show for the 100th, I think. Like, we'll have to bring back guests and do some really cool
It's
things.
interesting. In the Google Photos thing on my phone, I happened into it. If you hit people and pets, it'll give you a montage of all the faces of the people that are right. You have pictures of it. It's kind of like the same thing with the green room.
We need to do that because I think it would be kind of cool to have a reunion. And it was really funny yesterday. Oh gosh, no, her name escapes me. I was at a rally yesterday. Okay, we have to start with our green room, and our green room is always a little bit heavy in the morning, a little bit political. So,
we have to get our therapy out. But no, listen, it's been a rough week.
It's been a very
for progressive thought. I don't know, Ruta. Listen. So right.
Well, I think it's.
We've all lived for 50 years under a certain assumption about the right of women to make choices about their health care. Yeah. And listen, and I know, and I'm not putting words in your mouth. I know many women who would never personally have an abortion or a termination of pregnancy, unless God forbid you have a fetus that's blighted and and there's the health of the woman involved. But my point is, I know many women that would never personally have an abortion that still believe in the right of other women to make their own personal choice. I have to say that's my thing. I wasn't going to put words in your mouth.
Because for me, on a religious basis and on a personal level, I am pro-life, but I'm pro-choice, because for me, I don't want someone telling me what I should personally do. So for me, I think every woman should make that determination. They have to live with that for the rest of their life. Their circumstance is not mine. And again, I don't know, and this is the thing for me, it's an unknown factor, because I don't know how I would take it had I, conceived a child and God forbid there were just horrific deformations or something. I don't know what I would have done at that moment. So, but I don't want to make that decision on someone else's behalf. And I don't think it's my call. I just believe in, I always tell people, I believe in human rights. All rights are human rights. And for me, a woman, she determines herself as much as a man determines what he does. For me, if you're LGBTQ, you're human. You deserve the same rights under our Constitution.
I think that's what's buzzing the nerves of everybody is Justice Alito's view, of the world, right? And the imposition, and the loss of a right that we've now had for 50 years. And everybody knows my discussion that I have with patients is about being a physician in 2022 who understands society in 2022. And I want to speak to this as an emergency physician, because public health will always be my interest. And when I started emergency medicine in 1982, it was right at the end of the quote unquote rusty coat hanger abortion phase, because Roe v. Wade, 1973, but there were still complications that we were seeing in the ER for women that had those procedures. And here's the point, is that women will always terminate pregnancies. They will. And I would never equate this with a cannabis issue. Don't get me wrong, everybody. But just like people will always use cannabis. Point is, you have to understand in 2022, it's safety, it's education, it's advocacy. And that's what's so important. And listen, when Dr. Auld comes in, she's an OBGYN physician. She's not in quite yet, because listen, everybody has their own personal views on this, and I absolutely respect hers as being somebody who's been on the front line of this for years. from the emergency medicine standpoint, mine will always be, this is a socioeconomic issue. This imposes upon.
I think this is the biggest point, because if you look at statistics, okay, the wealthy women, even in the 50s, wealthy women had no problems getting illegal, like a legal or a safe abortion. I shouldn't say legal, but a safe abortion. Should they need it, had they had an affair, had they had something go wrong and they wanted to terminate the pregnancy. That today is still the same case. The socioeconomic impact is on poor women. They still are having hard time getting access. I know they say, oh, Planned Parenthood. Well, you defunded, you want to defund, and you have defunded Planned Parenthood. You're taking away any options that these women have.
There's only one provider in North Carolina already, or excuse me, in North Dakota, not North Carolina.
I don't know.
In North Dakota already. I mean, there's access issues already.
Issues now. And again, the women that are impacted tend to be lower income. And so what they're doing is they're punishing, literally, like, I feel like they're punishing these women. And okay, give them access to healthcare. You know what, if you want to take this right away, then give women full access to healthcare, and make it open so that women have this option. And again, like somebody yesterday on my Facebook posted, they're like, oh, there's Planned Parenthood. I'm like, do you know what women face to go through Planned Parenthood? People are throwing like paint on them, cursing them, telling them they're going to hell, doing this just to go to Planned Parenthood to get contraceptives. They're not even there for anything else. They're just young girls trying to get contraceptives. And here you go, in the society, and this mentality is like bashing these young women from even entering in to get contraceptives. And then the other thing that I have to say this, and I'm sorry, my mother said this at 99 when she passed away, and her whole life, and she was a generation ahead of where she should have been. She said, what about the men? You put this onus on women and you make women suffer through all this. You know what? If it's so mandatory for women not to have abortions, let's make it mandatory for men until they're married and ready to settle down. Give them a vasectomy. It's reversible. It is reversible. Yeah. Where in women's healthcare, you cannot do the same reverse. Let men have that. Boys become of age. Let's do that. If we're going to become this crazy ass society that we're regulating people's bodies, let's regulate some men. And hey, you know what? The pregnancy issue will go away.
Now, listen, Vice President Harris asked that question of Brett Kavanaugh, okay, when he went through his confirmation hearing, if there were any procedures, okay, that would be done to men. Listen, something, and we talked about lying.
Why is it when it's regulating women's bodies? Wow, that's great. Let's do it. Do you ever notice it becomes a hush subject? They don't even discuss it. Why?
Listen, we talked about lying. Fair. We talked about lying in last week's green room, okay? And the erosion, unfortunately, of our government because of it. I want to call out, okay, these Supreme Court justices, okay, who were asked directly about precedent, okay, and outright lied about it, okay, and Susan Collins, I think, is the one who is kind of bringing up the issue, and the other Alaskan senator who is, her name is
Moreau.
I don't know, it's escaping me. But the point is, that's why they go through the confirmation hearings, so that we can get an understanding of their outlook, okay, on where we're going.
And we're on the Constitution. I mean, you're supposed to rule this country by laws. It's not God's laws. It's not, because the religion of this country was supposed to be eliminated. So you cannot say it's in God's hands, because this country removes God, should have, and by Constitution removes God out of this scenario, and you rule by law. And again, so why is it that you're imposing these laws on women only and not on men? And then, and
on doctors as well, though, on doctors as well, that would perform, but here's the point. Listen, and let's welcome in Dr. Ald. No, for sure, because I want to go a little bit into where it could lead to the loss of contraceptive rights, right? Or the loss of gay marriage rights or voting rights or other rights that aren't necessarily guaranteed in the Constitution. Yeah. That's kind of what was, I think, really the trigger in the Alito wording of the discussion,
Yeah.
but it's all about women's health today.
But
We
it
do
should
have
be
Dr.
women's
Ald,
health.
who is our friend and partner down in Fort Myers. And,
Yeah.
let's just give a little shout out to, the Fort Myers Compassionate Cannabis Clinic as well. Southwest Florida Integrative Health,
awesome.
of course. And, we're so grateful to have that arm down there in Fort Myers doing unbelievable things for their patients down there. So welcome, Heather. Great to have you.
Good morning. Can you hear me okay?
We
Yeah,
can.
And it's funny too, because, and I want to just flip this in quick. People say, why don't you have 10 Dr. Berry centers in this state? You know why? Because we can't find 10 Dr. Berries or one more Dr. Ald. And I mean it. We know how hard it is to try to do that. And we so respect you for doing what you've done down there, and really with the focus on women's health and other integrative health, and for men too, that you do down there. So, once again, much respect for all of that. Not easy.
It's mutual, so I appreciate that. I do want to I knew that I couldn't help myself but say something about your topic. The thing that bothers me most is that we have politicians saying medical things that are absolutely not true. For example, DeSantis the other day said, you can have an abortion just before term and snuff that baby out. Well, that's called a delivery. If you're at term, that's called a delivery. And it's just crazy what they say. And you know what? I don't know really one OBGYN doctor that knows what a partial birth abortion is. I've had it described. I've never seen or heard anybody ever in their life doing that. It makes it sound like people are barbarians. It's very, very unfortunate that we have politicians making medical decisions both for women's rights and health, and also for cannabis, because they say preposterous things.
Well, I'm glad you said that, Dr. Ald, because a couple of weeks ago we were talking about that very issue, that there was a magazine, or actually it was
in the
newspaper.
It was.
And it seems to be a trend, especially in Florida, where
they're not taking. It was Dr. Ladapo. No, it was Dr. Ladapo sending out advice on trans kids.
But it's not. It's on cannabis. It's on every subject. Like Dr. Ald said, politicians are getting involved, and they're not taking expert opinions from the physicians at all, or the medical profession. And it's crazy because they're just dismissing it. Whether, like I said, whether it's cannabis, whether it's LGBT
advice on trans kids. That's what it was. Yeah.
I mean, anything. It's just they're not taking it in particular. For some reason, this state, I don't know, they're really at the forefront of not listening to experts in the field, and they're making their own outlandish and crazy non-fact based statements. And unfortunately, the public, if you don't know, they're listening to these people, and that's very dangerous. And it's not a good precedent to send. And I'm glad you mentioned it. And it's regarding all issues. I really think they just disregard anybody with any qualifications here, especially in the medical side.
You're right. Yeah.
So we lost it. We lost your
It's got to get closer.
You got to get a little closer to the microphone per Don, the expert producer. There you go.
Okay. I said it's not right. They should not play doctor.
They should.
Well, no, what Ruta's referring to is that, doctor, and you probably saw the memo from the state. It was the state actually telling pediatricians and psychiatric, adolescent not to assist the trans kids, in really their counseling and this and that. And of course, that's insurance. And so it was the professors and the leading experts in the field pushing back and saying, stay out of what we do best, and don't try to put out this politically motivated garbage, which quite frankly is what it is, so when we see too much of that. Listen, Heather, the reason I really wanted to have you on today, besides obviously focus on women's health issues, but I saw what you said to Ruta was adult diapers are actually now, hang on, they're now outselling. Well, no, I have to say it at least one time in every green room. I'm going to be 66 in 2 weeks.
So you're wearing diapers now?
No, I'm not. But I'm not. But it leads one to the thought. And when you hear that adult, hang on, everybody, and you'll have to tell the art because you know because it's your deal, not mine. But adult diapers are outselling kid diapers. What is that about?
Isn't that astounding?
It is.
Yes, in this country, there are more adult diapers sold than children's diapers, at least an equal amount. And that doesn't count the poise pads and all those other things. You know, it's really
So that's a term.
not talked about. It's not
Right.
talked about. And I am, of course, you know, I'm getting older. And as I see, my patient population is also getting older. And so I routinely say, do you ever leak and urine? And you would be surprised the percentage of people, even younger women from childbirth, have the problems. But as we get older, it's gravity, it's just aging, it's having children, it's lack of estrogen, and it's getting to be an epidemic. And we know that surgery is not always the answer. You know, surgery is fraught with complications. And in an integrative world, we try to keep people out of the operating room.
Oh yeah, for sure. No, listen, I mean, for everything, I think having a surgery these days, and listen, they try to keep things as sterile and as clean as they do, but we know that MRSA is a term that nobody ever wants to hear. And that could be for any surgical procedure. And, you know, once that happens, then you're into the world of the PICC line, which is an IV, antibiotics at home. It's a disaster. But of course, we're talking about a term called incontinence, right? And I'm so interested in the fact that, of course, as we've all developed our practices through the years, would you say that's a question now that you're actually asking that you necessarily weren't asking 10 years ago?
Of course
right.
It is, you know,
right.
And because at first I wasn't asking that all the time, but, you know, sometimes you see remnants of their, you know, they leave their diaper in my wastebasket. I don't mean to be, you know, so crude about it. So then I realized this is not just now and then. This is becoming a lot.
And a woman necessarily, or a man, they wouldn't necessarily bring it up to their doctor, right? Because there's shame issues, or right, Heather? Oh no, I'm asking.
Yeah, because I think women not so much. Because I think all women know, like you sneeze and you're like, oh, gotta go.
So I mean, right. So would you say that there has been a barrier necessarily to the women bringing it up, or not so?
Well, they have not in the past. So occasionally they would. There's nothing to do about it, and they weren't about to have surgery. Every now and again, if they had something really severe, their daughter would bring them in if they were older and say, listen, what can we do about this? And we used to put pessaries. I remember you told the story about the homemade pessary. I remember that you told me about tomato that we put up there to protect it. And that's another story. That one. And
that's a story that didn't quite come through because your mic's still a little, you know, listen, in the old days, what Heather's speaking to. Heather and I go back to 1981, everybody. I mean, way back. We did our residency together in Cleveland. An old remedy for a uterine prolapse, which could cause that urinary incontinence, would be to cut a potato in the shape of a pessary and actually put it up to hold the uterus in place so it wouldn't come down. So believe it or not, in the ghetto of Cleveland, we would have the presentation. We would have the presentation. We would have the presentation of vines in my vagina, and you would go in and you would literally see the vines growing out. So the joke would be that what do you do about it? Well, you clip them and you see them in the clinic on Monday for a red rubber pessary, right? So that's the story that Heather and I have shared for a number of years. But the point is, listen, so in the old days, of course, and now there's still surgeries that are done to lift, right, and try to take care of some of the anatomical things, and you know that can be wrong with it. Listen, Move, of course, has a vaginal spray. Interestingly, so kind of give us a little bit of a, you know, OBGYN view of all of that type of stuff.
What are you recommending for women? Because I know we have a lot of women tuning in today for like something on an integrative side, alternative side of surgery.
So I do try to, of course, vaginal estrogen or even hyaluronic acid, which is what we use on our face for wrinkles, actually helps increase the tissue strength down there. So that does help considerably, but especially vaginal estrogen does help. But more recently, for the people that do have considerable amount of urinary leakage, we've started to use radio frequency down there. And it's done in the office. It actually is painless, and it can really make an impact, and it doesn't hurt at all. Now, if they have a little bit more severe or if they have some other diseases that I don't need to talk about, we can do actually microneedling with the radio frequency. And I know that sounds like, oh my goodness, I don't want needles down there, but it actually is very well tolerated. I wouldn't say it's comfortable, but it's really not uncomfortable. And it can make a huge difference in restoring the health back to its former glory, I want to say. So, I say this is the year of love your vagina again. And I think that we need to do it. They also does have that vaginal gel, which actually significantly can help when people have painful intercourse, and also can help when they have severe menstrual cramps. And you can use it topically on your belly or in the vagina. Even sometimes people put it around the outside because of painful intercourse, and it really does make a difference.
So are you seeing like, as far as like, Don just brought up a good point about, the ratio of people having incontinence now is outweighing, but I think that's a birthing issue because our birth rate, like we just don't have as many children anymore. And I think the population is getting older, obviously. So what do you see like going forward with like women's health on that, like as far as like incontinence and just everything in general? Like you talked about estrogen, and the only question I have is, aren't there some links also though for like, is that hormonal like replacement? Because I know there's a lot of links to breast cancer, and it's not something that a lot of women want. And I don't know why some physicians are still prescribing it, because it really does have a very, very high link to breast cancer.
Well, thank you for asking that. I use bioidentical hormones, which actually were not used by too many OBGYNs in this country because they have to kind of follow the rules. If it's not a pharmaceutical, they don't give it. The bioidentical hormones are often made up by compounding pharmacies, and you can give estriol, which is a weaker estrogen that's typically given, and it actually helps with the collagen and elastin formation in the vagina. And you can give it, when you give it vaginally, if I check your blood levels of estrogen, they don't go up.
Oh, wow.
So that's why it's a much safer route to give it that way. And you only use it a couple times a week, but it has tremendous results. So there's a lot of different ways to give it. Also, we can give DHEA, which is like an adrenal hormone, which also does the same thing for the vagina and doesn't increase risk for breast cancer. But as long as we're talking breast cancer here, the biggest risk for breast cancer is using antiperspirants and eating a inflammatory diet. And, I think that there are many things that we can do to help prevent that, because only 10% of breast cancers are hereditary. And 90% of them are from lifestyle.
Wow.
Well,
I never knew that.
No, I never
thought
did
it
either.
was
I never really
hugely-
heard the antiperspirant.
Oh no, that's been going, but that
yeah.
was like, I used to hear it for a decade. We heard it for a long time, and everyone said, it makes sense because of the area that it's around, and plus women shaved, and so you already have the irritated skin, plus you're putting the deodorant on
Wouldn't you
top
think
of
that
it.
the government would want to protect women from such things like that?
Yeah.
Oh, I guess we're going back to the opening part of the show.
But no, it is kind of crazy if you think
Yeah,
about
it's
it.
the methylparabens in it that are used. They used to use formaldehyde for antiperspirants as a preservative. Now it's the methylparabens in it, and that really acts as what they call endocrine disruptors. And I think that I touched on that last time that we were talking about endocrine disruptors, which is in just about the average woman gets exposed to 12 different things in their makeup and in their lotion and things like that. And that just has not been changing. Although a lot of women now, there are a lot of alternatives that are healthy forms that are really making headway.
They are, and I know like even like paraben-free shampoos, everything, like, there's a lot more now choices, which is nice because I look for that, because now I thought of that, like I said, even in my mom's time, my mom's like, she's like, I don't think deodorant's very good for women. Like,
listen,
like where everything is.
No, I mean, in 2022, you just never know where things are coming at you from, so all you can do is pay the most attention. Go ahead.
No, but I'm just shocked at the hereditary thing with breast cancer. I really thought the link would have been reversed, like 90% hereditary and 10% not.
Sure. Well, if your genetics aren't good, then you better watch your lifestyle even more so. Listen, I wanted to bring up Ukraine a little bit, Heather, because I know you've been doing great things down there in Fort Myers, and we were talking a little bit before coming on. And us here, of course, at Compassionate Cannabis Clinic, I know we have the dance event coming up, Ruta. So I wanted to let you yak about that. And Heather, tell us about what you guys have been doing down there.
So I put just an email blast out to our patients, and I am so overwhelmed and thankful. I could not believe such a response.
It's unbelievable, isn't it?
At least 40 big boxes. We didn't ask for money, but we had almost $2,000 in checks to go to the Ukraine. And then we partnered with the Ukrainian coalition down in Naples. They just sent to the Ukraine 11 full box cars full of medical supplies, and it went directly to the Ukraine and flown there and was received within 2 days. Awesome. And I couldn't be more overwhelmed or thank our patients enough. What an outstanding response. I thank you, thank you, thank you.
Yeah, same here. I have to say, like, our patients, like, we put out the same thing, an email blast, and patients were calling and coming in with food items and medical supplies. And then we had, and I have to give a shout out, there were 5 pharmacies. They're Coptic Egyptians. They're all related.
Oh, they have those great hats.
Yeah. And they, because of the Slavic Orthodox, they feel tied obviously to that church as well. Sure. So they donated close to $500,000 worth of medicines. They gave us,
I wrote a lot of scripts.
Tons of scripts. I was like, it was crazy what they were doing. They were giving from antibiotics to, silver-based burn creams for trauma. The things awesome. It was awesome.
And Ruta saw her boxes that she had labeled actually.
That was incredible. There was somebody Facebooked me, and they're like, Ruta, your supplies got there. And they had on Facebook Live, there was I think 4 or 5 Ukrainian soldiers, and they were unpacking our boxes, and I saw the boxes with my handwriting. I'm like, oh my God, those are awesome. I was like, it was as awesome as it could get. Yeah, I was like, and then they were opening the boxes, and sure enough, it was the supplies we did, and I'm like, oh my God, it got there.
Yeah, I love that.
Yeah.
Tell us about the dance event and make sure everybody knows about
that. Next Saturday in Sarasota, we're having it. The thought came to us because I do ballroom dancing on the side as a hobby. And so I was in a studio, and there was a Ukrainian girl there, and she's like, it would be nice to do something, as another kind of fundraiser. And the owner of the studio overheard us, and she's like, why don't you use the studio? And I said, why don't we do like a Ballroom Dancers Unite for Ukraine? And I said, why don't we call because there's lots of ballroom studios. And I said, why don't we call them and see if they'll participate? So it's the first time actually, even in Sarasota County, according to the ballrooms, that they've all come together, because usually there's jealousy and rivalry between the ballrooms, but they're all coming together next Saturday at 7:00, and all the proceeds that we collect from the door to food sales to everything is going to Ukraine. So, and we have a girl that's going to be singing. She's Ukrainian, this girl, Natalia. Her dad is actually in one of the battalions in head battalions. And so the money will be sent straight to the battalion, and then they are actually going to be purchasing what they need, because one thing that they said is they are having some difficulty getting a lot of trucks over because of the roads being destroyed and things like that. Sure. And they said sometimes it's easier for them. They do the orders and they get them through Turkey, and somehow they come through a lot easier. So we plan to give all the funds to the battalions that are on the front lines, and awesome. It's nice to know that it's going straight to these people that.
So really that's Saturday the 14th.
Saturday the 14th, 7:00 at Sarah Dance Studios, which is 2821 Cattleman Road in Sarasota. And what was nice is all the dance studios. They put, personal rivalries of dance studios together, and they all are donating, as sponsors, they're donating money so that we can buy, decorations and supplies for the event. And then they're also even having their pros come out and do special dances for Ukraine, which is really nice. And we're going to have a whole group of Ukrainian kids. They're going to be doing the national dances of Ukraine. So it's going to be it's going to be a really nice event.
Great night of unity.
Of unity, and it is.
Is the art show still going on too? Because I saw the art from those kids.
Oh,
and I haven't had a chance to get up there. Is it still? Is it still there? Or is it gone?
I don't know. I think
I know.
it may have ended.
But that was awesome. The art from these kids.
This was like this.
It's 9 o'clock, but how can we got to end on that because it's inspirational.
There's a Polish. He's like myself. Like I'm first generation. He's first generation Polish, and he's an artist. And he and I met a couple of weeks ago when we were protesting Rumble. Anyways, he had this fantastic idea, and what he did is he wanted to get artwork from children in Ukraine and in Poland, the refugees and the kids that are still there. So he had boots on the ground, both in Poland and in Ukraine, collecting things from children and the artwork that the children are drawing right now. And it's incredible to see. And they actually brought over through Poland some of the burnt like textbooks of these kids.
Yeah,
and
the burnt math
textbooks.
Yeah.
I mean, it was
really,
the
black and white
the
spirals.
But I mean, they were burnt and like charred, and the drawings,
but the money goes right to the kids.
And the money goes straight to these families. Every kid, and you can choose as many as you want. So I donated to almost every kid's picture. And so but it was so great. And you see but you know what was interesting? You see both hope in some children and a despair. You'll see some kids that are drawing black and red and sadness. And then you have other children that were still drawing the sky and Ukrainian flowers, the sunflowers, and you saw and then
the truth through children's eyes, man. Art Linkletter, I think it was. Kids say the darndest things or whatever it was.
Oh, but there was another one.
Got to be old to remember that. Sorry.
No, but there was one in particular. It's a girl's drawing, and it was amazing. Her mother's a sniper. And she had the crown, the Ukrainian, the floral crown of Ukraine that they wear. She had that on. She put her mother, the drawing she did, she put her mother with, the embroidered Ukrainian.
It's somewhere on my Facebook.
And a sniper gun. That was the picture that she sent over because her mom is a sniper. And they had a Ukrainian flag in the back. The girl drew. I mean, it's so impactful. I mean, it's incredible. And so there's some nice things that have just happened here, and we have our issues
in the face of the man's inhumanity to man. You can still see goodness bubbling up.
Well, and I think Dr. All said it. You put a call out, and that's where I think this country actually has to it unifies people. Tragedies, unfortunately, they do, whether it was 9/11 or now in Ukraine, but these tragedies bring people together of all backgrounds, and people really do want to ultimately, I think, help everybody. And so for those that are living in Fort Myers or close, even I have a girlfriend, I just recommended somebody to you that she lives in Venice actually, and to go to your practice. So because a lot of women are looking for alternative healthcare and integrative medicine. No doubt. I mean, and they asked me, and I'm like, I have somebody.
We do. We have somebody. Listen, before we get out of here, next week's Green Room, Representative Carlos Guillermo Smith is joining us. Yeah. I'm the producer of the show, so I pre-booked him. No, I'm teasing. Talk to Carlos. He's going to be able to join us next Thursday, and of course, I'm sure he'll have a lot to say about pretty much everything.
And so we'll give a quick shout out to Dr. All's office. Give us your information, your office information, your hours. And for all the women listening, she's a great OBGYN and integrative physician. And I can't say enough. And like I said, I recommend you to everyone that's looking for alternative care for women's health. So take it away and give us your plug.
All right. Well, thank you very much for having me. And we are another arm of Compassionate Cannabis, Integrative Medicine, and Integrative OBGYN or GYN. And our address is 1570 Colonial Boulevard in Fort Myers. And our number is 239-208-6676. And anybody that Dr. Berry sends, we'll be glad to see.
Great. Awesome. Thank you so much. We'll see everyone next week, and Slava Ukraini.